Assalamu alaikum. I'll start by washing my hand. Okay, I will give the doctor my ID. May I take a moment to read the case, please? Okay, perfect. Hi, my name is Abdiziz Al Agha. I'm fourth year medical student. May you confirm your name and age, please? Okay, I've been asked to do a general cardiovascular examination to you. Is that okay with you? Okay, the price is insured by closing the door. And are you currently in any pain?
No.
Okay, I will ensure good exposure by removing the upper part. But now I'll stick with this. And I will ensure a good position. So can you lay down on the bed, please? And I will ensure he is in the 45 degrees. Okay, I will start with the general inspection. As I can see, the patient looks normal, not in distress. The body build is normal, not obese, not too thin. There is no discoloration or cyanosis, for example. He is not connected to anything in the environment, like oxygen mask or IV lines. And also, ideally, I will ask for the vital signs from the doctor. Okay, now I'll move to local inspection, and I will start with the hand. So can you please do like this? Okay, for the dorsal part, I can see there is no peripheral cyanosis, there is no splinter hemorrhage, and there is no ocular node. Okay, can you turn your hand, please? Okay, for the palmar aspect, I can see there is no xanthomata, and there is no tar staining, and there is no John-Wee lesion. Okay, can you do like this? Like this? Yes, please. I will see. Okay, there is since there is a space, diamond shaped space. There is no clubbing. Okay, thank you. Now I will assist the capillary refill. So, yes, give me this finger. I will press on it till the blood or the white coloration appears. Then I will remove. Since the blood comes back in less than 2 seconds, the capillary refill is normal. Now I'll move to the forearm. So yes, please, can you do like this? Okay, I will start by inspection. So as I can see, there is no needle track marker, and there is no rheumatic nodule. Also, I will assess the temperature on both forearms. Okay, the normal and symmetry. Now I'll move to measure the radial artery. So I will put my index and middle finger on the radial artery. And I will assess 3 things: the rhythm, the rate, and the characteristics. So for the rate, I will count for 15 seconds, then multiply by 4. And ideally, it would be between 60 to 100. Okay, it's approximately 76 pulse per minute. For the rhythm is regular, and the volume is normal. Now I will move to before I move to collapsing test, I will assess the symmetry between the radial arteries, and I will do radio-radial delay test by measuring the both radial arteries together. Okay, they are symmetry, and there is no abnormality. And ideally, I will do radiofemoral delay test. Now I'll move to do a collapsing test. So I will palpate the radial artery and support the forearm by my other hand. And before I start, do you have any shoulder pain?
No.
Okay. I will raise your hand fastly and see if there is any shifting in the pulse. Okay, I feel there is no shifting, and the test is normal. Okay, after that, I will inspect the face. So I will start with the eyes. Can you please close your eyes? Okay, there is no xanthelisma. Can you open it again, please? I'll check if there is any pallor. There is no conjunctival pallor, and there is also no jaundice. Now I'll move to the cheeks. There is no malar face. And now I'll move to the mouth. Can you open your mouth, please? Okay, I can see there is no central cyanosis. There is no any problem in the dental hygiene. And also there is no abnormalities or deformities like high arched palate, which indicate there is no Marfan syndrome. Now I'll move to the neck region. I will assess 2 things. the carotid pulse and the GVP. For the carotid pulse, before I move on, before I measure it, I will look if there is any roots in it by using the stethoscope and put the diaphragm on the carotid artery, which is medially to sternocleidomastoid. Okay, there is no root. Now I will palpate the carotid artery and measure the same three things we measured in the radial artery, which are the rate, the rhythm, and the characteristics. I will put my index and middle finger medial to sternocleidomastoid and calculate for 15 seconds, then multiply it by 4 to know the rate. Okay, so it's approximately 76 beats per minute, and the rhythm is regular, and the volume is normal. Now I will measure the GVP, so I should ensure that the patient at 45 degrees. Can you look at the left side, please? Okay. First thing, I will identify the pulsation, the internal jugular vein pulsation, which I can see it's here, lateral to sternocleidomastoid. And if I cannot see it, I will do a hepatojugular reflex by pushing the lower part of the right abdomen. And after that, it should the internal jugular vein should appear clearly. Now, since I can see it, I will bring the rurals. I will put the first one at the sternal angle, perpendicular to the ground. And I will bring the other one, put it horizontally, and try to locate the pulsation, the highest pulsation point. Okay, so it's less than 3 centimeters, and this is normal. Okay, after that, I will move to the abdomen. Ideally, I will have a good exposure, but now I'll stick with this. For the abdomen region, I will inspect firstly and see if there is any abnormalities. Then I will look if there is any organomegaly, like hepatomegaly or splenomegaly. So I will palpate here in the right upper quadrant to see if there is a hepatomegaly, in the left upper quadrant to see if there is splenomegaly, or both of them is normal. And also looking for any ascites. So I will do a fluid thrill test. Okay, there is no ascite. After that, I will move to the lower extremity examinations. I will start with exposing or have a good exposure. Okay, as I can see, there is no varicose vein, there is no cyanosis, and there is no ulcers. And now I'll move to the palpating part. So what I'm going to do is I'm going to press on the both tibial shaft together and look if there is any edema or pitting edema. Okay, there is no pitting edema. Ideally, I will have a better exposure. And lastly, for the palpation, I will palpate for the dorsalis pedis pulse. Okay, the pulse is intact and everything is normal. That's it. Thank you for your collaboration. I will cover the patient and I will wash my hand. Thank you.